Guys, my name's Emerson Tercios, and today we will be going over a sexually transmitted infection project over HIV.
HIV is a human retrovirus which attacks the body's immune system. Without proper treatment, can lead to death.
All right, today we'll be moving on to how is it transmitted. So most people get HIV through anal or vaginal sex, sharing needles, syringes, or other drug injection equipment. Now, how is the STI passed from person to person? HIV can be passed from person to person through vaginal, anal sex, and blood, such as sharing needles. Another one that will be mentioned forward is HIV can be transmitted from mother to baby during pregnancy, birth, or breastfeeding. The body fluids that transmit HIV are blood, vaginal fluids, rectal fluids, semen, preseminal fluid, and breast milk. Most common forms of transmission are HIV through vaginal or anal sex. Anal is the riskiest, which there's an increased factor, especially for the receiving partner. Vaginal sex would probably be the next one. Oral sex, it's possible to transmit HIV, but it's very difficult. Somebody would have to have like an oral sore in their mouth where they're bleeding, and the semen goes in there. That'd be an interesting way for that to happen. Another uncommon way might be, I think there was one occurrence where it happened where the mother was chewing up the baby's food, and she had some blood got into the food and fed it to the baby, giving the baby HIV. Next is how it can be prevented. Use protection when choosing to have sex and using condoms properly, ensuring that you use only one, not two. That'll increase the chances of it ripping. There's also a thing called PrEP. It's a pre-exposure prophylaxis. It is said to reduce the risk of getting HIV by at least 74% if taken as prescribed. It takes 7 days for maximum protection for receptive anal sex and about 21 days of daily use for receptive vaginal sex and injection drug use. If your partner has HIV and maintains a consistency with their ART, the antiretroviral therapy, they can reach an undetectable viral load, meaning they will not transmit HIV to the other person. So there are some drugs that you can take that make your viral load so low that if you have sex with your partner, you won't give HIV to them. So that's kind of what it's talking about.
Speaking of viral loads, when your viral load is undetectable, that means that you cannot transmit HIV. They have a new campaign that says U equals U, which means that undetectable equals untransmittable. Next, I am going to go over the signs and symptoms of HIV. And the first part of that is serial conversion. Sometimes people do not have any symptoms at all. However, if they do experience symptoms, those symptoms include fevers and chills, general malaise, night sweats, rash, generalized lymph nodes, headache, and muscle aches, and weight loss. You can also experience mouth ulcers and diarrhea. Now, after it has progressed, it then turns into AIDS. AIDS is basically a set of symptoms that basically you have after the HIV has been in your system for a long period of time. And those include you have rapid weight loss, as well as like muscle wasting, extreme fatigue, like you can't even do your daily life, like cooking or cleaning, things like that. Prolonged diarrhea, prolonged swollen lymph nodes. You get sores in your mouth, your genital areas, and your anus. There's also these blotches on your skin, could be red, pink, or purple. And you get those characteristic opportunistic infections such as yeast growth, and it's usually thrush, or it can be in your vagina or anus area, and as well as pneumonia. And this particular one is specific to HIV.
So how can you be tested? You can go to your local Department of Health or your primary care provider, whichever is the best suited for you, and then you can just ask them to be screened for HIV. What they'll do from there is an antibody test or an antigen test. An antibody test is a test that uses a blood sample or saliva, and an antigen test is a blood test that looks for a specific antigen called P24. Is there a cure or treatment? Currently, there is no cure. However, there is medication that you can take to suppress the virus so that it's undetectable. Unfortunately, it is going to be a lifelong process once you have HIV, so you will have to take your medication for the rest of your life. They have medication in pill form, and that would be the first line of treatment they use once you have HIV detection. It's used to get the viral load undetectable. They also have shots available, and that is considered the second source of treatment to get your viral load to be an undetectable level. But you can only use the shots after you've started the pills. Once your viral load is undetectable, it cannot be transmitted through sex, but that does not mean you can stop taking the medication or not use protection measures such as condoms or vaginal dams. As long as you take your medicine as prescribed and don't miss doses early on in the detection process, no damage to your body should be done. However, if you don't get treatment quickly or you just don't take the medicine, HIV can weaken your immune system and make your body very susceptible to infections, and it will make your body very hard to fight off infections if you don't treat it. So these are the HIV rates in 2019. The HIV population of teens in 2019 was 7,709 teenagers were diagnosed with HIV in 2019. The HIV general population that was diagnosed in 2019 was around 37,000. The Gainesville population that was diagnosed in 2019 was 963, and in Georgia, 2,000 people were diagnosed with HIV in 2019. This is our works cited. We used mostly the cdc.gov website, and we also used hiv.gov. We want to all thank you for watching and listening to our PowerPoint, and we hope that you guys have learned some valuable information.